On the day of surgery, you'll arrive approximately an hour before your procedure begins. During that time, we'll review your history and physical that was taken during your preoperative assessment. And we will also give you some medications that will make you comfortable for the procedure. The procedure room may look very much like this and is all done in office. You will be awake and alert, although very comfortable, during the procedure, which usually takes about 2.5 to 3 hours. At the beginning of the procedure, the tumescent fluids are infiltrated, which usually takes about 45 minutes to an hour, and then we begin to remove the fat. The fat is removed through very small, approximately 3 millimeter incisions that are made in various locations to allow us to gain access to all the areas that we will be working. Post-operatively, we will leave these incisions open, and you will be draining fluid during the course of the evening and for the next 1 to 2 days. In the immediate post-operative period, you will be wearing 2 garments. One is a dynamic compression belt that aids with the efflux of the fluids from your body, and that one you will only wear for approximately 3 days. The other one, the compression garment or girdle for women, you will be wearing probably for 3 to 4 months, although there are exceptions to that. At 1 week, we will follow you up, and we will use a special plastic surgery tape that aids in the healing of all your incisions, which by that point in time have closed, and will produce wonderful cosmetic results for that. We'll also begin diet medication for you to continue to aid in your weight loss. During that first month, I want you to eat a high-protein diet and limit the foods that trigger insulin release, like potatoes, white rice, and white breads. Following your first week's appointment, you will begin your synergy treatments. Synergy treatments are a lymphatic massage that are designed initially to aid in the healing process for the lymphatic system, and subsequently to allow your lymphatic system to remove the fluids that accumulate in your tissue. At a month post-operatively, we will begin a diet tailored specifically around your needs, and we will also balance any hormone irregularities. And between that 1 month follow-up and 4 months, we will follow you up as needed on an individualized basis to ensure that you will develop healthy eating habits and that you are going to be able to maintain the results that you have achieved during this 4 months for the rest of your life. Anticipate that you will have 3 days of discomfort post-operatively. While it is considered a minimally invasive surgery, it is a surgery nonetheless, and you can anticipate being uncomfortable. I recommend that you take these 3 days off from work. In the initial 1 to 2 days after the procedure, you will notice that the fluids that we initially put in, the tumescent fluid, will have drained out, and you'll be able to see your new shape emerging in the mirror. Subsequent to this 2 to 3 day period, though, the healing process begins, and you're going to experience more swelling in the areas that we already worked. This is a well-established and well-reported course of events that occurs following liposuction, and it's due to the healing process, which involves inflammation. Part of that inflammation causes leakiness in the vessels, and you can anticipate that you will probably gain back enough fluids to get back almost to that original size that you were preoperative. This process lasts about 2 weeks and resolves very quickly between 2 and 4 weeks as the lymphatic system heals. Subsequent to that, you may experience some areas of localized tenderness, which will dissipate over the next several weeks, and you may on occasion notice some areas of numbness, which should be resolved no later than 3 months. I look forward to seeing you in the office in a consult, and I look forward to answering any individual questions that you may have. I hope that you found this little tape helpful. Thank you.